Okay, folks, this is your Chapter 3 online lecture about empowerment and human diversity. Really, this is far too big a topic to talk about in a 15-minute lecture, but I will do my best to be respectful of the groups that we're covering and things like that. Why are social workers interested? Because of social policy. Social policy deals with disenfranchised or marginalized groups. And it also deals with groups that are dominant, that have the majority and the power and economic power and things like that. So social workers are necessarily involved in areas of human diversity. It also impacts our individual development. If someone has more advantages or more disadvantages, that impacts the way that they have a chance to be successful in our society. Okay? We also need to remember to look at the relationships between the groups and the dominant culture. If you're working with a person who is Native American, well, their cultural group does not have a lot of good experience working with the dominant culture in the United States. You can't ignore that. Okay? It has to be taken into account. Just some general terms to know. People sometimes use the words discrimination and prejudice interchangeably, but they are different things. Discrimination is an action. If you believe that someone is less intelligent because they have purple hair, that is a prejudice. If you treat them differently based on that assumption, based on that prejudice, once you treat them differently, that is an action, and that is when something becomes discrimination. Okay? Oppression is whenever we put constraints on a person, a group system, and we do not let them achieve their potential in society the way that they normally would without those extreme constraints. Marginalization or a marginalized group is just a group that has less power, or they're viewed as less important because they belong to a particular group. Now, that group could be based on immigration status. That group could be based on sexual orientation or gender expression. That group could be based on race or any number of other things. Alienation, all people understand this to some degree, but there's a big difference in between feeling alienation because you are 14 years old and trying to figure out what you want to be as an adult and as a person and things like that, and being the only person of a particular group and being made an example of. Okay. Talked about prejudice already. A stereotype is just a fixed mental picture that we apply to everyone in a group, and we know that that's wrong to do. It is not just ethically or morally wrong, it is intellectually wrong. Okay? The stereotype would be all women love shoes. Well, I'm quite certain that if I just ask, I could find 1,000 women who don't care anything at all about having more than 2 pairs of shoes. It's a stereotype that we're applying whenever we apply it to all members of a group. I gave you a fairly not harmful example of that, but sometimes these become very harmful if we think that one particular group of people is violent, or one particular group of people, all of them are sexually aggressive, or one particular group of people, all of them are intellectually inferior. Okay? A lot of these can be very, very harmful to people. One way that we can measure prejudice, because it's an attitude, it's hard to measure these things, is by what's called a social distance scale. The social distance is how closely are we willing to interact with members of some other group. Okay, you think about if we use members of a religious group named the religious group named the Bottle people. Bottle. Okay? If you're willing to have them in the country, that's one thing. Are you willing to work with them? Are you willing to let your children work with them? Are you willing to let them come to your children's school? Are you willing to let your children be friends with them? Are you willing to let your children go to church with them? See, as we close that social distance and we get closer and closer to things that we are emotionally attached to, many people start putting up barriers in order to keep other people away. That is one way that we can sort of measure the attitude known as prejudice. Certainly, student opinion shows greater trend towards social acceptance. Probably the biggest pushback we had against this was the September 11th attacks in 2001. There was prejudice against Arabic people and people of the Muslim faith long before then, but that certainly brought it to the forefront of people. Diversity is just looking around in your society, looking at what's similar and what's different. It is not a good nor bad thing, but it's just noticing. Okay, at risk is a group who has a higher chance of discrimination or a higher chance of failure due to unfair treatment because they belong to that said group. Poverty is one of the largest at-risk groups we have in the United States. Why do we pay attention? One of the things that we start to see is minorities are overrepresented in these different areas. I talked about poverty, specifically children in poverty. Minorities have lower educational attainment. You can look at this at Texas Tech enrollment, and this is painfully obvious. State-supported universities are supposed to support their section of the state. West Texas has almost 50% Hispanic population. If you look around Texas Tech, it is not near 50%. Last time I checked, it was 8. I think Texas Tech is trying to do a lot of things to address this, and that is good, but it just shows how much farther we have to go. Another way that you can see this represented is with lower wages, specifically among women. Women make less money than men for the same type of work, and that is repeated over and over again. Okay? One thing as social workers that we try to do is look at things from a strengths-based perspective. Strengths-based perspective is we look at strengths rather than weaknesses because it gives us a starting point to build around. Okay? If a client is struggling economically and they are struggling with alcoholism, but they have a good family and their family loves them and they love their family and that is stable, well, let's build on that family because if we can make that strong enough, that will help us deal with the addiction. That will help us deal with poverty. That will help us deal with all of these other things. We need something strong to build from. Okay? And that is the reason for strengths-based perspective being one of those foundational beliefs of the field. Whenever working with clients from another culture, it's important to understand their culture. Okay, culture is just our language, religion, art, values, norms of behavior. Do you look somebody in the eye or do you look away? Do you shake their hand or do you wave? All of these things, anything that you do is basically culture. As social workers, we want to practice what's called cultural competence. The book will define this as mastery of a particular set of knowledge, skills, policies, so that we can work from somebody from another culture. I will tell you, you will never master your own culture, much less someone else's. However, you can make steps to learn as much as you can about a culture that you're going to be working with. If you're going to be a social worker in West Texas, it would be a wise idea to try to understand the cultures that are present around us. Okay? Because it's going to impact the way that people treat you and respond to you and and it will impact the way that you can respond to them and be the most effective social worker that you can. There are certainly other types of diversity. Social class impacts the way that we live our lives in almost every interaction we have on a daily basis. Political ideology, we are seeing the country become more and more divided instead of having open, honest discourse, but that's another area of diversity. Gender, sex, sexual orientation, covered in the text in a very minimal way, but those are other types of diversity that could potentially impact the clients that we're working with. Okay, I'm going to briefly go over a few more different areas where you could see diversity. Certainly gender and sex are areas where you can see diversity. I want to understand that we are using these in very clinical ways. There's a difference between sex and gender that people try to overlook all the time. Sex is your primary and secondary sex characteristics, physical. Okay? Gender are personal traits or positions that we attach to being male or female. Usually, from a scientific perspective, it's easier to think of gender as being masculine or feminine. Now, when we think about that as a way of being masculine or feminine, you understand that that is a continuum, because even if you get 3 men together, one of them will be more masculine than the others, or 2 of them will be more masculine than the last one, but they're all 3 still men. Okay? But there is some variety in this. So it's on a continuum rather than an either-or kind of issue for gender. Now, to be a little bit more nuanced, gender identity is a person's internal psychological concept of being male, female, or sometimes parts of both. But this is internal. That is their identity. Now, how they express themselves, that's how they communicate to other people about their own behavior, their own personality, things like this. And this is brought out in all manner of our actions as well as our attitudes. You think about if you spit on the sidewalk in public, you wouldn't, at first you might not think of that as a gender expression. But I can tell you I've only seen maybe half a dozen women in my entire life cough up something and then spit it out in public just without shame. Very, very few, where I've seen thousands of men do it. Okay? So that one thing is just as an example of gender expression. Gender roles, attitudes, behaviors, rights, responsibilities that go along with being male or female. And these are constantly changing. How we express gender and how we expect gender is constantly changing. Okay? You think if you were a man 300 years ago, if you took more than 2 baths in a year, people probably assumed that you were being effeminate by that, because no one should really care about doing all of that, least of all a man. In modern society, I will please ask all of you to shower more than twice a year, because it's a social expectation that you will, and there's not the assumption that it's going to make a person effeminate. But it certainly was viewed that way in that time frame. So the only reason I bring that up is just to show you how our concept of gender changes over time. And that was a long time ago. But these things actually can change very quickly. Another group that can be marginalized are women. Women experience life very differently than men. They're more likely to be poor for a number of reasons. One, they earn less money. They're given greater caregiver responsibilities. Women are expected to typically care for the children much more than men. If men and women are not together as a familial unit, many times you will see the women with the children rather than the men. Even women in social work will earn about 14% less, and male social workers are much more likely to be head of it or administrators of large institutions than women are. And this is one of the more progressive fields that you'll see. Sexism is just prejudice or discrimination based on sex, especially discrimination against women. And it's almost always used to give people unfair treatment based solely on gender. There are probably 3 or 4 jobs of note that men might experience discrimination in and could not get because they were males, where there's probably hundreds of jobs where women would be viewed as less than if they were to go after those jobs. Now, that doesn't mean that men don't have problems. Men are certainly socialized to be strong and unemotional and things like that, which can be harmful to them whenever they are seeking treatment. But this is just one problem, okay? And many times whenever we have the benefit of economy or privilege or something like that, it helps men in a much larger way than it would help women. There are other areas of diversity, specifically sexual orientation, aging. As our country gets older, more and more citizens will be needing services. And with the exception of COVID in 2020, and then following it up in 21 and 22, as a country we are getting older because medicine has gotten better. The average age of death has gone from 65 to 75. Now it's about 83. It's just one area of diversity where we'll see people, because your needs will be different at 45 than they will be at 70. Okay? Disability, whether that's cognitive, physical, psychiatric conditions, health disability, we need to be mindful of prejudices and stereotypes about people living with disabilities. Then we have our own chapter about people with disabilities later on in the semester, but that is certainly an area of diversity. Religion and spirituality is certainly a big part of many people's lives, but we also need to realize that this is an area of diversity, and if you are a religious or spiritual person, that's great. But it is important that we do not force that on clients, as they may not be spiritual, or they may be spiritual in a very different way, and it is not our job to force our spirituality on anyone. Certainly, the same perspectives that we talked about in earlier chapters will still be true in this one. Conservatives will be much more thinking about personal issues with this rather than systemic barriers, whereas liberals are more likely to view social structure as the problem whenever it comes to diversity and things like that. Radicals typically look for privilege and think that that's what helps the dominant group stay in power, and there's a certain amount of logic that follows that step as well. All right, this is the end of your